Yeah, my name is Antoni Montserrat Moliner. I have been during 30 years official in the European Commission, and during the last 13 years I was the person in charge of the rare diseases policy in the DG Santé of the European Commission. Nowadays I'm working for the Comité National Maladies Rares in Luxembourg, who is the body responsible for the implementation of the National Plan of Rare Diseases. Well, we had very interesting discussions this morning, and always what we can see is the need of really sharing knowledge, because even if we have a lot of organizations, a lot of possibilities, a lot of conferences that permits to share the knowledge, it is true that a lot of the time that is always lacking. But it's structures like this, conferences like this, that permits to different experts in different countries, in different continents, because today it was very interesting, the contribution of the colleagues from Africa, in the sense of we need to take into account in really objectives of democratizing, for instance, clinical trials, the participation of African countries and African institutions. I think this spirit of sharing knowledge is really what characterizes normally all the meetings organized by the European Personalized Medicine Organization. Well, certainly there are the different European Union programs, the Horizon program, the EU for Health program, that permits creating spaces of cooperation financed by the European Union to achieve certain objectives. Because, well, the European Union is able certainly to give legislation or recommendations, but we need always projects and joint actions where the different institutions, researchers from the different member states should be together for obtaining certain objectives. Of course, the problem at the level of the European Union is that the competences for health legislation are minimal. Health is not agriculture or trade in the case of the European Union, and competences are very limited. And this is what obliges, in a way or another, the different actors in the different member states to be really active in the sense of looking this cooperation in a really will basis, because it's not something that it's obliged by the law that you cooperate in the field of health at European Union. You should do it because you know and you believe that you should do it. And I think this is the possibility that we have with meetings like this to create this discussion and this communication. Well, as I said, I think that the most important thing, it is true that COVID-19 changes all. We have now a European action plan on health and public health, the EU for Health. I hope that in the new multi-financial framework for the new budgetary period, it will be renewed, not with this name, because it seems that the Commission is thinking in including health in the competitivity fund, etc., etc. But I think that now the big discussion is a political discussion between the member states, between the Parliament and the Commission, in how to implement the future multi-financial framework, which will be exactly the contribution of the European Union to the health policy. And on the other side, it is true that a lot of things have changed after COVID, and a lot of countries have discovered the importance of the prevention, early detection, words that were simple words before, and now they have a very precise meaning, and a very precise meaning in the sense of creating spaces of cooperation and the spaces of preparedness. Another one of the magic words now in the European Commission, preparedness, thinking in maybe a next pandemic, etc., etc. And I think that's a little the main orientation of the healthcare policy in the European Union in the future. Preparedness, prevention, early detection, action.